Osteoporosis is having breakdown in our bones, and it happens as we age or if our nutrition does not include adequate amount of calcium. So the American College of Obstetrics and Gynecology recommend bone mineral testing for women starting at age 65 years. And postmenopausal women, so women after they have their menstrual periods have ended, are to continue having uh, osteoporosis or exams, because one of the beneficial effects of having menses is that we have adequate stores of estrogen, and as we age, that decreases. So postmenopausal women that's over 65 years have an increased risk of osteoporosis or softening or bone fracture from osteoporosis. So the amount of bone material that's there is lessened, and because of that, our risk of having fractures or breaking of our bone is increased. And breaking your bone actually has a lot of really adverse effects, including, depending on which bone is broken, actually can lead to death. So the DEXA scan, please definitely have it done if you're recommended by your healthcare provider. The DEXA scan should not be performed more frequently than every 2 years, depending on your history. If you're high risk, so this is a person that's low risk, but if you're high risk, then definitely your healthcare provider may have you complete a DEXA scan at a shorter interval than every 2 years. And a fracture assessment scale predicts your risk of having a fracture depending on what the DEXA scan results are, and that could be done every 10 years. The U.S. Preventive Service Task Force recommend osteoporosis screening for women aged 65 years and over, and again, younger depending on your risk factor. It's also recommended for males at age 70 and those 50 to 69 years who have a risk factor or have had a fracture as an adult or had a history, a family history. So men are also recommended to have screening for osteoporosis and having an DEXA scan, so it's not only for female. The Endocrine Society guidelines recommends the following high-risk males be screened for osteoporosis management with a DEXA scan. Again, those age 70 and over, between 50 and 65 years, if they have the following risk factors: low body weight, they're smokers, or had a previous fracture, and I'm going to add also having a family history of having a fracture. Colorectal cancer, so that's cancer of the colon, is actually treatable if it's found early. So colorectal cancer screening is a colonoscopy, and the recommended age keeps changing. The latest literature says between 40 to 45 years. That's a low-risk person. Again, no family history or no personal history of having colorectal cancer. And the earlier it's treated is the better the outcome, the more curable it is with better outcomes. A repeat negative, so if you had a colonoscopy at 45 years and it's negative, the next time it's recommended is between 5 to 10 years. And again, once you get to age 75, if all of your colonoscopies have been negative, then it's recommended that you don't need to have any additional colonoscopies. I know a lot of persons are really apprehensive, are fearful about doing the PrEP. The PrEP is the worst part of the colorectal cancer screening, because most persons are put to sleep during the actual colonoscopy. So drinking the gallon of fluid is what everybody's afraid of. It's one day. You're not going to starve to death, and once you have it done, you actually weigh less because you're completely clean. And they will go, there's a new recommendation or new preference for having the Cologuard, which is doing the stool sample at home and sending it off to the lab, which is fine. But if that comes back positive, you're still going to be recommended to have a colonoscopy. So it's every 10 years. Drinking the liquid is the worst part. Just make up your mind that it's going to happen and have a colonoscopy. So those are the recommendations for having a colonoscopy. Again, high-risk person, having cancer yourself, so in the colon or in the rectum, or having a family history of someone with colorectal cancer. There's actually no recommendations for screening the extremities unless there's an actual problem that you're going to tell us about, unless you have diabetes. Because when you have diabetes, it actually affects every system of your body. So a lot of persons with diabetes, especially if it's uncontrolled, their blood sugar is uncontrolled, could end up with decreased circulation in their feet. So you would be recommended by your primary care provider to actually see a podiatrist, which is a person that deals with the extremities, especially the feet. So what they look for is a loss of sensation. So if you're coming in and you're saying you're having tingling, they touch your feet or they do a test on your feet and you said you don't feel it, then you're actually developing what's called peripheral vascular diseases. So the blood vessels in your feet are actually breaking down because of your out of control sugar in your or glucose in your blood and your system. So what they're looking at is a very low risk. So there's no loss of sensation. There's no loss of affecting your mobility or ambulation or your ability to walk. And if the screening, if the first test that you do is 0, then your next test is recommended every year. So once you're diabetic, you should have this test every year if you're at low risk. That very low risk, sorry. When you're low risk, so you have some loss of sensation or some development of peripheral arterial or vascular disease, then you're recommended to have this test every 6 to 12 months, depending on what is found. And a moderate risk, your sensation decreases, you have more evidence of developing arterial issues, or you're having difficulty walking, then the recommendation as far as follow-up, the intervals decrease. As you could see, it's moderate risk is every 3 to 6 months, and a high risk is where you're actually having problems that you are able to notice, and their recommended follow-up is every 1 to 3 months. So there's no preventative screening test for the brain unless there's a problem that you've noticed. Then you speak to your healthcare provider and you're referred for follow-up. So these other systems of the body really don't have regular recommended preventive screening. The brain, the nose, the chest, the liver, the stomach, spine, or the back, and the extremities if you're not diabetic. So these other systems don't really have regular recommended screenings, but definitely if you see something, you know your body best. If you see something abnormal, definitely let us know.